Ecklin Morning Program on KSJE.
And my guest this morning, as I mentioned, from San Juan Regional Medical Center, Meghan Ritz is back with us this morning. She is the physician's assistant, also works very closely with the Metabolic and Bariatric Surgery Program at San Juan Regional. Welcome back to KSJE. It's great to have you here.
Yeah, thanks for having me again. It's good to be here.
You are welcome. Happy New Year.
Happy New Year.
We were talking a little bit about that and, New Year's resolutions or maybe some New Year's goals for healthier living. I'm sure you hear that a lot, maybe in your line of work.
Oh, all the time. I love
Right.
a good goal. I do a lot of goal setting, and this is definitely the time of year where people come in with resolutions.
Right. And we were talking a little bit about the differences between maybe resolutions and goals, right? And so maybe your goal is not so big, gigantic thing to try to
Yeah.
achieve. Is that kind of the
Right.
idea?
So a resolution is something that's really big and lofty and kind
Right.
of doesn't have a lot of direction.
Right.
A goal is more specific, and it does have better direction and I think are more achievable if done right.
Sure. And so with the work that you do, talk to me a little bit about the Metabolic and Bariatric Surgery Program at San Juan Regional Medical Center, because you do a lot of, I think, goal setting, maybe with your patients, and talk about things that they can do to achieve how they want to live and how they want to feel and things like that.
Yeah, absolutely. So we're going into our third year. We're a comprehensive
Congratulations.
Yeah, thank you. It's exciting. We're a comprehensive weight loss program. So we provide both medical weight loss and surgical weight loss.
Okay.
Medical weight loss being using some medications to help assist with weight loss. Those things like the GLP-1s that everyone loves to talk about.
We've been hearing a lot about those,
Lots,
right?
Yes,
Okay.
and keep your ears open. There's going to be more coming down the pike with those types of medications.
Okay. I
And
guess
then-
they're very effective for some people, right?
Very- yeah,
but you
very
can't use them
effective.
just the medications alone.
No, you still need to do the lifestyle, the work behind it. Same with surgery. So
Yeah, sure.
we always talk about surgery or medications being the tool. It's either, doing surgery with lifestyle changes or medications with lifestyle
Right.
changes. You can't do it without the
Gotcha.
lifestyle.
And your program offers both, I guess, paths, right? Both options for patients?
Both options, again, that comprehensive weight loss center. So we do offer both options. So surgery might not be right for some people or something they're not interested in. And then we can do medications. And then we even also work with a lot of patients who don't want medications or surgery. They just want some accountability and support and understand what does it mean to live a healthy life so I can either lose weight or improve metabolic health.
Okay, got you. And so that seems like that old advice, that old adage of eat less, move more
Oh, yeah.
is pretty good advice then for most people?
No, I disagree with that advice.
okay.
The old adage of eat less and move more. I mean, there is some truth to that.
Okay.
Certainly,
So
but it is way more complex. And
Okay.
it's really different for everybody.
leave it to the media to simplify something
Oh,
very
absolutely.
complex, right?
Absolutely.
Okay.
That's old school thinking. That's,
Okay.
the old school diet culture.
Got it.
But that is where the goal setting comes in, because we need to look at what are the things that somebody struggles with that contributes to weight gain or difficulties with weight loss.
Right.
And then we go from there and kind of pick a couple things to change,
Right.
setting goals to help improve lifestyles.
So it sounds like to me that what you're saying is these things are very individualized depending on the person, the patient, and things like that. You just can't take some of that advice you might hear on the radio or what have you and think it's a one-size-fits-all solution.
Exactly.
Okay.
Exactly.
Got it. And so for some people, I guess maybe surgery is a good answer, maybe if, or whatever, or maybe medications or other lifestyle changes is another option for them too. Because I know with your program, I think some of your patients have seen really great results from surgery. And that's a great thing to be able to show people and talk about too in some cases.
Right. Yeah. A lot of our patients have seen life-changing results from surgery. We typically look at what are the goals, how much weight are we looking at that we need to lose to help improve health, quality of life, and then tailor that treatment approach. Medication sometimes, surgery, sometimes even surgery with medications.
Right. All those things, right?
Right.
They're all tools in the toolbox, I guess,
Correct,
to be
yeah.
able to meet these goals for your patients. And so if someone wants to lose a lot of weight, is that usually maybe more of a surgical option then? I mean, if we're talking
Yes.
tens and tens of pounds or hundreds of pounds or things like that?
Typically it is. With surgery, you can achieve between 20 to 30, 35% total body weight loss. Medications, it's more like the 10 to 20%. So really it just depends on not only weight loss, like how much weight do I need to lose to get healthier or achieve my goals, but also what other medical problems do I have where surgery is going to be a really powerful tool to help me achieve better health.
Now, what could that mean? What is that? What could that be?
Insulin-resistant diabetes, type 2 diabetes, is a great example where
Right.
some surgical procedures for weight loss also really drive home the fact that it's about metabolic health, changing the body's metabolism so that we can get rid of diabetes, insulin-dependent diabetes, or even, diabetes where you're taking oral medications.
Got you. Sure.
High blood pressure, cholesterol, joint pain, back pain. There's a lot of things where surgery can really help alleviate those medical problems.
And let me pick up on joint pain, back pain, and things like that, because
Sure.
I guess if you're carrying around an extra 50 pounds, 75 pounds, whatever it is, that does stress your knees and hips and back and
Right.
things like that. And so getting rid of that, or most of that, or some of that, would improve those conditions, I guess, as well, is what you're saying.
Yes. Don't quote me, but I believe it is for every extra pound of body weight, it's about 3 pounds of pressure on your joints. So, if you add 10 pounds, that's 30 pounds of extra pressure. So it really does help a lot of patients with mobility and just relief of chronic pain.
Got you.
Yeah.
So the reverse would be true too.
Right.
If we were to quote you, but we're not going to quote you.
Yeah, please.
But
don't.
I hear what
I'd
you-
have to
but-
check my facts.
I understand. I hear what you're saying. But yeah, so that can be very helpful as well. And so that's the surgical side. And then, of course, also with lifestyle changes, diet, nutrition changes, things like that, because all those things seem to go together, do they not?
They do, absolutely. Can't do one without the other.
Right. And that's for long lasting, I guess, to make it stick, I guess,
Exactly,
too, right?
for the durability. So, when you have bariatric surgery or you use medications for weight loss, you're going to lose weight. That is the intent. Most people will lose weight.
Sure.
Even if they're not making a lot of lifestyle change. It's about a year after surgery where you've lost the weight that you think you're going to lose from that procedure, or you've been on medications for 2 or 3 years and you've come down to that goal weight. If you stop the medication, but you're not doing lifestyle behind that, you're most likely going to regain weight. Same is true of surgery. About a year or two after, that's when the weight starts creeping back on because habits didn't change.
Got you. And so with your program, is that something that you all kind of help your patients with after those programs, the surgery or the medication or whatever? I mean, do you want your patients to check back in with you or
Absolutely.
maintain kind of that relationship to see how they're doing and help them if they do
Yeah,
kind of
we
fall
do.
off the wagon, so to say?
Yeah, we do a ton of follow-up. In fact, we really focus on follow-up. We want to see patients as much as possible for medical weight loss or surgical weight loss so that we can keep having those touch points and keep guiding and supporting and holding patients accountable. Sometimes patients really love our program because they get that accountability portion.
Right, right. And you said at the beginning of our conversation this morning that this is now your 3rd year in the program. You told me before we came on the air that you are growing. The
Yes.
program is growing.
The
And so so that's got to be a great measure of your success, and patients that are telling other folks about their experiences and things like that, word of mouth and other things are getting around the community about what can be done here locally.
Right, yes. Definitely word of mouth has been helping. Referrals from primary care, specialty clinics. So I think the more we're here, the bigger our presence becomes and the more that patients and providers and just the community understands that this is a program that's not only going to help patients with weight loss, but really it's a program that's going to help support that long-term health and just really be a part of the community.
Right. Very true. And for people that are just maybe, again, it's the new year and they're just thinking about, wow, I could drop a few pounds. Is the program right for them? Is it a little bit maybe overkill for maybe wanting to drop not maybe 20 pounds, maybe 5 or 10 or 15 or what have you? Can you help folks with just that goal in mind too?
Definitely, because a lot of times when you're looking at dropping 5, 10, 15 pounds, we're going to really look at the whole picture, the whole patient. And many times we're struggling with metabolic disease, so blood pressure, cholesterol problems, diabetes, sleep apnea, and we can help with weight loss and also address different ways that we can change lifestyle to alleviate those burdens, those medical disease or problems.
Got you. And so my sleep can impact my weight?
Absolutely. Sleep is a big factor when it comes to weight loss and weight management. We do a lot of deep diving into sleep therapy, sleep hygiene, and look at ways that we can support patients so they can increase their sleep, improve metabolism, have better energy and vitality. Sleep is critical. It's
Got
a
it.
hard one, though.
Right.
Yes.
Well, and there are different types of sleep too, I guess, right? Because you have, you could sleep, but then if you have good sleep, that is refreshing and
Right.
regenerating, reinvigorating, all that stuff that really, I think, helps the body to kind of like regroup for the next day,
Right. Heal,
basically, right?
recover, process. exactly. Improve energy, concentration, ability to stick to goals and resolutions, appetite control. I mean, there's so much about sleep.
Yeah.
So we that is a big component of it. That's a lifestyle change that many patients don't think of. Everyone thinks about exercise, diet, nutrition, but we do a lot of counseling and guidance and support around sleep. And then, of course, stress management, which is also big, but also very difficult to help patients figure out how do I reduce my stress?
Right, and that was going to be my next question to you about stress and how that enters into things as well. But if someone is in a stressful situation, stressful lifestyle, just stuff going on, that can impact weight and weight gain and things like that too.
It can.
I guess we have stress eating.
We have stress
we hear about
eating
that a lot.
all the time. I
Yeah.
mean, who hasn't stress eaten
Of
or had
course,
some
right.
kind of emotional
Those
behavior?
single-serving tubs of ice cream come to mind, right? That maybe aren't single-serve. Yeah.
Yeah, but stress, not only from the behavior aspect, but biochemical changes. It does change our hormones that regulate metabolism and appetite. So managing stress is kind of this, chasing a dragon in many ways. We all have very busy, stressful lives, but looking at ways to just tweak things so that you do feel less stressed, or even if you don't feel it, your body feels it.
Yeah, exactly. And so for hearing all these different things that enter into what we're talking about, it's not as simple maybe as it sounds, or as we might see advertised or what have you.
Yes,
because
it's definitely not less, move
multifaceted.
more. It's so complex. It's
Right.
so different for everyone.
Exactly. And so is that part of your job when folks are coming in to have a consultation, or at least ask some questions about
Absolutely.
trying to lose some weight or
Yeah.
just feel better? And do you try to look at the overall lifestyle of the patient
We
and
do.
what needs to maybe be
Yeah.
thought of or talked about?
I think a lot of patients are taken off guard when they come in and they have an hour-long consultation with us. And it's not just like, okay, great, you want to lose some weight, here's some medications. It's really deep diving into not only their medical history, but also their weight history, social history, to really understand what are some things that are contributing to this patient's inability to lose weight or maintain weight or get better health, and then coming up with a plan using medications, but also the plan for the lifestyle changes that we feel are really going to be most impactful and really help move the needle so that patients start to see those changes on the scale or in their life, or with medications that they can now stop taking.
Right.
Yeah.
And I guess, again, that is what makes the program so successful too, right? If folks can stick to that plan and put into place these medications or surgery or nutrition, exercise, things like that we're talking about, that really means that these changes may stick
Right.
longer, because it is hard to change our habits. We know
It is
that.
hard. It's very hard.
Our bad habits, I would say, too.
Or any
Yeah.
habit, whether you
Yeah.
want to have a good habit, make
Right.
a new habit, get rid of an old one. It is really hard. But again, accountability and having somebody to guide you through that can be very helpful for most people.
Sure. And so for the work that you do, are there some tips that you give to your patients about, because again, I think about nutrition and things like that, and we are bombarded by ads for food, maybe not the healthiest of food. We're driving down Main Street, we see a lot of signs for food, and restaurants are there and things like that. I mean, that's constant distractions, I guess, from trying
Right.
to get us off of our maybe goals that we set with you in the program, right?
Right. So we do a lot of work around nutrition. We have a dietitian who works with our program. She has a lot of experience in both bariatric surgery, but also just medical weight loss. So she guides and counsels. We do a lot of food logging and monitoring to help patients understand, get that real life feedback, like what am I eating? And then we never prescribe a diet or a calorie deficit. We just look at the big picture and see what are this person's patterns, what are their habits, what types of foods do they prefer, and how can we start changing that so that they can achieve goals with weight loss or reducing cholesterol levels, improving glycemic or blood sugar control.
I see. Interesting. And so I guess then if someone has a favorite food, it doesn't mean that that's off the table, or
No,
can't
never.
eat that ever again,
Right.
but maybe eat less of that and more of something over on column A or what have
Right,
you. or-
correct, exactly. Never tell yourself, I can't have that, because the brain wants what you can't have. So
Right.
It's easier just to, focus more on 80% eating for health and wellness and 20% incorporating some of those things that are either, hedonic, so they comfort me, or they're culturally important.
Sure. You mentioned the food logging. I wanted to ask you a little bit about
Sure.
that, because that's an important thing, I would think, to be able to identify what we're putting into our bodies and what we're eating, and that's something I think people can do even today, right? There's a lot of apps out there that are available to help kind of track that, and you folks may be surprised
Right.
as to how many calories they are ingesting every day
Exactly.
compared to how much exercise they're doing, and
There is
wonder,
no-
oh, well, that's
right.
where all that extra calories are going, right?
There is no shortage of free apps out there, and that's what I really try to impress upon our patients is we don't use this as a way to beat you up and make you feel bad about what you're doing. It's a way so that if you do go get fast food, you can look at how many calories you're eating and then start making different choices.
I've hit my goal for the day with this one meal, maybe, of how
Or
many
not even
calories.
that. Or exactly that.
You
Like
know.
2,000 calories
Right.
at lunch.
And
based
I'm
on this
done.
meal. How
Yeah.
can I make it a little bit different?
Right.
And oftentimes when we're talking about changing nutrition and having those goals, I want to eat healthier, right?
Sure.
That is a great way to do it, to start by saying, okay, instead of saying I'm never eating this again, that's oftentimes too extreme, a resolution that's very extreme,
Right.
The all or nothing thinking. How can I do this differently to support my goals? So how can I maybe get a grilled chicken breast and have a small French fry and get water instead? And so it's like those baby steps. So then maybe, 3-4 months down the road, now you're preparing and cooking and meal prepping your lunches at home, but Rome
Right.
wasn't built in a day, and so just taking those small steps can be a way to get there to those big eventual goals.
Yeah, exactly. And I think, too, the other side of that with some of these apps is maybe you can also log your activities, your exercise, or your walking, or whatever it is that you're doing to try to, again, be more active. And
Right.
it's always interesting to me, I think, just how many calories, well, for me, I'm eating and how many calories I'm burning, and they're usually not the same. And one number is usually a lot bigger than the other number, and that's a little disappointing, but it tells you kind of where things stand.
Right, and it's also rather inaccurate when you're really trying to get into the weeds there with how many calories am I burning and
Right.
eating, and so it's better to use them as tools for accountability. So how many days am I walking? How many minutes of moderate intensity exercise am I getting versus really focusing in on how many calories am I burning?
Okay, good to know.
Yeah.
I'm glad that you said that. Now I feel better about it. But
Yes, yeah, don't get lost in the weeds there with
right,
that.
because I ingested this many calories, only burned off that many calories,
Right.
and so they didn't
And then
equal,
it's-
and now I don't know what to.
Right,
I'm stuck.
exactly. And so then it's not simple anymore and it becomes very complex. And so really we should be keeping things as simple as possible when it comes to changing habits for health, because that's how you're really going to be able to stay in the game.
True, very true. And again, it's complicated. I think there's a lot of things that impact our lifestyle, our weight, our health, right? And so to try to make a change to that, it's hard to just do like one tiny little thing and think that that's going to have major changes in a lot of other places.
Well,
Does that make sense?
Not true either.
Okay, all right.
Because
Tell me
another
why.
thing
Tell
I
me
have
why.
to impress upon a lot of my patients is those 1% changes,
Right.
the 1% gains or losses, right? They eventually add up over time. And it's the
Okay.
importance, it's the power of consistency with doing those one little things that will eventually get you to where you want to be.
Really?
Yes.
You sure?
Positive.
Okay.
Positive. Oftentimes patients come in and they have lofty goals or intentions or resolutions, and if you don't see the big change you want to see right away, right, you give up.
Right.
And that's why
Right.
many people don't follow through on those New Year's resolutions. I want to get healthier, or I want to lose 20 pounds, and you want to do it right now. But if you set the goal, make it more of a goal, right? I want to get healthier by drinking 3 glasses of water, or I'm going to lose 5 pounds in the next 1 month, and I'm going to do it by going to the gym 3 days a week. That's going to get you that 1%. You're going to meet that goal, and then you're just going to be able to more likely continue and move forward with it to get to the eventual 20 pounds.
Okay, I see.
I hope that
I see
makes
what you're
sense.
saying.
Yeah.
Yes, it does. It does indeed. And I guess again, being able to make those goals that are definable, not just I want to lose 5 pounds.
Right.
The end.
Right.
But I want to lose 5 pounds in a month, like you said, by doing this. That helps it be defined, and so we can follow that and know how we're doing in that month.
Right. Goals are great, but SMART goals are better.
Right.
SMART goals are specific, measurable, achievable, relevant, and timely. So, as a classic example, I want to eat more vegetables. Well, we need to make it relevant. Why? Why do you want to eat more vegetables? Well, my provider told me if I eat more vegetables, I can improve my cholesterol levels and maybe I can come off of my statin medication. Great. So specifically, I'm going to eat more vegetables. You know the relevance behind it. You need to make it measurable. How many? Because otherwise you're kind of just blowing in the wind. Like, how do I know I'm eating more vegetables?
Right.
I'm going to add 1 serving to my dinner 5 days a week. And then you want to make sure it's time bound so that you know when your start date is, you know when an end date is, not to stop, but to just make sure that you can check in. How did I do? Is it achievable? No,
Right.
I didn't quite make that. Maybe I need to just focus on one serving 3 days a week.
Got it. Right. And do I notice the results by that stop date? Have I seen any
Right.
any improvement or
Right.
or what have you? Right. And
Exactly.
whatever it is you're using to measure that success or not.
Exactly.
So that's important.
Yes.
Very good. Meghan Ritz is my guest this morning. She is here from San Juan Regional Medical Center. She works with the Metabolic and Bariatric Surgery Program at San Juan Regional Medical Center. We have been talking about some achievable goals for the new year, and the program is there. And as we mentioned, even though surgery's in the name, it's not all surgery. Not all paths lead to
That's
surgery.
right. Comprehensive weight loss center. So I think that's a better way to think about it, because there's a lot we can do to help with patients improving health, losing weight, feeling better, and achieving their goals in 2026
Right.
and beyond.
Exactly. Very true. And so let me ask you a bit too about working with patients and insurance and things like that, without getting into the weeds either
Sure.
with insurance, because that could be a whole other show, right? But I mean, many times there is some help maybe for the costs involved, or to help maybe pay for some of these things that you offer through insurance and things like that.
Sometimes there is. It depends on insurance. It depends on.
I know every patient is different.
Everyone
right,
is
of course.
different, absolutely.
But it's maybe worth asking about.
Oh, it is. It is. And there's, we always think about that when we work with our patients. In fact, that is one of the questions I have, because I've kind of figured out some of those insurances all of our providers have. So,
Right.
There are other things we can do, even if your insurance doesn't cover medications or you can't afford them. There are some other tricks up our sleeve that
Good.
we have. So.
Okay, so that shouldn't be a thing that would keep anyone from coming in to talk with you a little bit about
Right.
their weight loss goals and things like that they'd like to
Exactly.
have.
It shouldn't deter them.
Right, exactly. Very good. Well, final minutes this morning. So any final pieces of advice for us on living healthier in 2026?
I think really just thinking about the big picture. What are my inspirations or aspirations for the
Right.
year? And then breaking it down into small goals, maybe even picking a theme for each month or a theme for the year. I want to improve stress, and this month I'm going to focus on sleep. So really just getting creative instead of creating these all or nothing lofty resolutions that you want to try and achieve. So break it down, make it easy, keep it simple.
I like it. Very good. I appreciate it very much. Some good advice. Thank you so
you.
much for coming in.
You're welcome. It was fun.
Always good to visit with you. That is Meghan Ritz, my guest this morning from San Juan Regional Medical Center, the Metabolic and Bariatric Surgery Program, here with me on KSJE.